Hi, I'm Dr. Allison Smith, head of the clinical team here at Precision Analytical, creators of the Dutch test. And I'm excited to welcome you to this presentation all about how the phase 1 estrogen metabolism ratios work on the Dutch test. In the updated version of the Dutch report, you will most certainly notice the pie chart has been removed from the estrogens section. We have done this to adhere more closely to the clinical research on estrogen metabolism, some of which is our very own. And in studies, the 16-hydroxy-E1 is compared directly to the 2-hydroxy-E1. And this is the same with the 4-hydroxys. So to stay consistent with that, our phase 1 sliders on the report display where a patient falls in the population percentile based on their direct ratios of 2 to 16 and 2 to 4 hydroxyestrone. And for a while, we had left the pie chart next to the population sliders because people were used to using it. But clinically speaking, the validity of the pie chart ratios can sometimes be limited by the dominance of one pathway. So I wanted to show you a case where an extreme 16-hydroxy preference completely obscured the 4-hydroxy dominance over 2-hydroxy-E1. This could have led to an improper assessment and the use of DIM even, which could have increased the 4-hydroxy-E1 even more. So the pie chart's been removed, and instead we consult the direct ratio sliders. A shift to the left or towards the 16 hydroxys and 4 hydroxys informs of a higher risk metabolism. And no confounder of the pie chart there anymore. Let's look at the sliders more closely in case you've been ignoring them or haven't gotten used to using them yet. The sliders represent the 2 to 4 and 2 to 16 ratios, but in population percentiles. So the green part of the population slider represents a ratio falling into the normal range. The white part to the left is a ratio lower than range. And to the right of normal, the ratio is higher than range. So pretty intuitive. Let's look at the 2:16 ratio first. Now this person has a low 2 to 16 ratio, and you can see the shift in the population slider towards the 16-hydroxy-E1 on the left. This is a 16-hydroxy preference. Right? Fewer than 14% of the people in the population have a worse 2 to 16 ratio. Right? That means a higher risk. Now let's do the 4 hydroxys. The 2 to 4 ratio is also below range. We can see that in the table above. Out of the entire population here, fewer than 4% of people have a worse 2 to 4 ratio than this individual. That's how you might think of it. Or 96% of people have a better 2 to 4 ratio. So this is a really strong 4 hydroxy preference. Not good. The phase 1 ratios can be found on the sex hormones table page. Here we can see the 2:16 ratio is 1.28, which is lower than range. And the 2 to 4 ratio is 2.98, also lower than its range. Both confer a higher risk, but how does that compare to other people? That's where the population sliders come in. How low is low? So we look at the population percentile sliders for that piece. Low ratios on the table page will cause the slider caret in the population percentile to pull to the left toward the denominator. This patient's low 2:16 ratio causes them to fall way down into the 11th percentile. Think of it like a grade in school. You don't want to make an 11 on this test. If you do, you've got some preventive work to do. In the 4 hydroxys, same thing. The slider caret is pushing all the way towards the 4 hydroxys. The slider in the 4th percentile is telling you this person is among the very lowest in the entire population. And 96% of people have a more protective 2 to 4 ratio than they have, right? They need some help. So let's practice. This patient has a low 2 to 16 ratio, and they fall into the 18th percentile. This is a strong 16 hydroxy preference. Let's look at the 2 to 4 ratio. So we see they have a higher than 82% of other people population percentile. I'll take that grade. This is a 2 hydroxy preference. So in general, this is considered protective. So that's how you use these. Then let us do the work for you. The About Your Results section lays out in very simple language what that all means. And in general, a low ratio is a higher risk finding, and a high ratio is a lower risk finding. Think of it as a 1, 2, 3 process. First, check the sliders for low population percentile results, or if your brain just doesn't think in population percentiles, that's totally okay. Assess the phase 1 sliders on the sex hormone table page for that information. Second, read the comments in your About Your Results section for that simple language on exactly what they mean. And third, use the findings along with other aspects of your patient's individual risk factors to make your final phase 1 assessment. And remember that sometimes even a normal phase 1 ratio might be actionable depending on other aspects of the patient's case, like significant symptoms or high parent estrogens, or maybe a significant oxidative stress burden. So set individual goals and be preventive. I hope this helps wrap your mind around the phase 1 sliders as we retire our old friend, the Dutch phase 1 pie chart.